And I want to thank everyone for being here today. And welcome to our program Making Health Literacy Local with the NNLM, presented by Sarah Levin Letterer. And I'm very happy that you're all here today. I'm Christine Brown, Outreach Services Librarian for the South Central Regional Library Council. And now I will introduce Sarah. Sarah Levin Letterer is a public health professional with 11 years of experience working in outreach, community engagement, and health education in a variety of settings. Since 2018, Sarah has been an education and outreach coordinator with the network of the National Library of Medicine Region 7 and a focus on public health partners and graphic medicine, partner outreach and engagement activities, including supporting grantees, teaching online and in person, and program development. Before joining NNLM Region 7, Sarah worked for the Philadelphia Department of Public Health on outreach to refugee and immigrant serving organizations, homeless serving organizations, and the Free Library of Philadelphia. Coordinating the collaboration with FLP included creating and teaching programs for patrons and staff, writing public health emergency plans that included FLP as a response partner, and managing the creation and distribution of health information bookmarks. And with that, I will let you take it away, Sarah.
Awesome. Thank you. And thank you for having me today. I'm actually going to turn my camera off once I do my quick introduction, although I've mostly been introduced. My name is Sarah. As Christine said, my pronouns are she, her. And with that, I'm going to turn my camera off and we will get started. So first, I wanted to start by mentioning our objectives for today, just so we can sort of put everything into context. By the end of the session, I hope that folks will be able to identify free resources and services from NLM and NNLM to support health programming, describe health literacy and its impact on overall health, and employ free resources to find local data and health information to create health programming for your organization. So first, I wanted to start by identifying who we are and where our information comes from. So when we talk about trusted sources, really starting at the beginning to say, this is who I am, this is the organization I represent, and these are the folks where we get our information and who we promote. Real quick, are folks familiar with the National Library of Medicine and the network in the chat? Okay. So I got one yes. We're a pretty small group, but I'm going to do this real quick so we're all on the same page. This is just a flow chart to sort of situate all of the pieces we are under and who we both sort of report to and where we get our information from. And so it's NIH to the National Library of Medicine to the network to Region 7. Breaking that down, the National Library of Medicine is an institute of the NIH and is actually a physical library on the NIH campus in Bethesda, Maryland. But the National Library of Medicine, for our purposes, is also tasked with creating and maintaining a wide array of online health information resources and databases. And these databases range from the highly specialized to databases with health information for the general public. And I'm actually going to mention two resources from NLM, live demo a third later. But I would also suggest you check out nlm.gov to see what other resources are available and to see if there are other things that might be useful for you and your institutions. So one of the resources to mention is PubMed, more than 36 million citations for biomedical literature from life science journals, online books, and more. This is a place to find published health science research. So you can find abstracts and citations. There are also instances of full articles or links to full articles. Unfortunately, although the search and citations are free, many of the full text articles are paywalled by publishers. So quick caveat on that. And then the other one that, we find a lot of partners are familiar with PubMed or familiar with Medline Plus. I did want to highlight the History of Medicine division because it is a great resource for potential programs in a box. As I said, the library itself actually is a physical library, and a big part of their collections are historical collections, and they are working to digitize those collections. And those collections that have been digitized are available for free, and that includes prints and photographs, manuscripts, films, and then they're also working to put those things into context. So lectures, traveling exhibits. Traveling exhibits are free with the cost of shipping. So no cost for the exhibit, but if you host a traveling exhibit, you are expected to pay for the shipping. The exhibits are 6 banners, and then the institution is encouraged to do some kind of programming around the exhibit itself. And the History of Medicine division helps with that programming because they do have lesson plans that are associated with each of the traveling exhibits. And those lesson plans actually are available on the History of Medicine division's website. So even if you're not hosting a traveling exhibit, you can use those lesson plans as sort of a program in a box. So when we move on from NLM, we move down to NNLM, which is the network of the National Library of Medicine, which is the regionally based outreach arm of the National Library of Medicine. And so it is 7 regional offices, 3 national offices, and 4 national centers. And all of these work together to provide training, funding, engagement opportunities to over 9,000 NNLM member organizations. And network membership is free and gives organizations access to funding, networking opportunities, and to trainings like today's. We are Region 7. We serve New England and New York. Our offices are at the UMass Chan Medical School Lamar Soder Library in Worcester, Massachusetts. And that's actually where I am coming to you from today. And so we, like I said, we provide the outreach and education and general support for NLM products to, again, New England and New York. Just to give you a little idea of what the regions look like across the country. That's us up there in the Northeast. And we work very closely with our colleagues across the country, and especially closely with our colleagues in Region 1, since we do share that border along Pennsylvania and New Jersey. As I mentioned, the regions are designed to be regionally responsive. And so we do have some region-specific interest areas that have been generated and that we have heard from our members here in Region 7 that are of interest. So these are areas that we put specific focus. We have peer-to-peer sharing for these things. We are always interested in looking at funded projects under these areas. These 4 are just a few of a longer list, but are ones that we thought folks might be interested in. So health information outreach in languages other than English, substance use disorder, graphic medicine, and climate as it relates to health. And the climate as it relates to health is also a small subset of a larger national initiative on environmental health. So I mentioned graphic medicine. I wanted to pull that out specifically because it is one of my focus areas. Graphic medicine is comics and graphic novels with a health, wellness, disease, or medical theme or storyline. People relate and remember information better when it's put in a cause and effect structure and when they have characters that they can identify with. Graphic medicine also helps introduce health topics that are often complex or sensitive in a way that's more approachable. It's easier to say, this character reacted in this way, or this character did X, than it is to say, oh, I had that experience and I did X. And, that feels it makes you feel sort of vulnerable. But if you can sort of talk about it in the way that a character did, and maybe as you get more comfortable or relate your own experiences, introduce topics that people may not have a personal experience with, especially ones that may have been politicized or have some stigma attached to. To support the Graphic Medicine Initiative, Region 7 has programs in a box. These are book club kits that are free to all Region 7 based organizations. They loan for 8 weeks. It's 6 copies of a book, a discussion guide, a how to read a comic. So they're good for long-time comics readers as well as folks who may have never read a comic at all. And then also supporting health information to put the story in context of sort of the more the statistics, the prevention information, things like that. So training like today's is another part of what we do. We have region trainings, member requested, so by invitation only. And then we also have a regional speaker series that is open nationally, but focuses on region specific resources, invites local experts, and is also focused on topics and information that we know is important to our regional partners. We also help support the National Training Initiative. So it's a slate of trainings free to anyone interested, supported by all regions, and then also offered in multiple formats to fit your schedule. So asynchronous Moodle, on demand, and live webinars as well. Most of these also come with free CEs. I mentioned that all regions do funding. Unfortunately, our largest funding stream, the RFP, is closed for next year, but this is something that we do annually. So it is a good time to start thinking about maybe the year after. So health information outreach is any kind of programming that is health information focused. So when we talk later about some of potential ideas for health literacy programming, the Health Information Outreach Award would be a good place to potentially get a little money for that. The technology awards, the RFP should be opening in early 2024. Most of our information and our resources that we promote live online. So we want to support organizations who are working to bridge the digital divide. So technology awards are software or hardware to address a technology need. One thing that's not listed on this slide is we also often offer collection equity awards, which are a block of money, usually opens in the spring, to address a collection need to support specifically health information and to fill gaps around equity information in your collection. So before I move on to the health literacy portion, are there any questions about NLM or NNLM?
I don't see any in chat.
Okay, so what is health literacy? So October is actually Health Literacy Month, so this is really good timing for this presentation. But before I get into the official definition, what do you think of when I say health literacy? What factors affect health literacy? Reading level, yeah. General literacy is definitely a piece of it. So these are the definitions, plural, from Healthy People 2030. And so if people aren't familiar with Healthy People 2030, these are standards set by the federal government with input from stakeholders at all levels of government as well as community organizations. The listening sessions and planning for this are actually open. So if this is something that you're interested in, see, we're in 2023, in about 5 years, they will start planning for the 2040 focus areas as well. And so Healthy People has split health literacy into two pieces. It's personal health literacy, the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So I think this is a lot of what we often think about when we think about health literacy, our own ability, the people around us, the ability of individuals to use information to make informed health decisions. Healthy People has introduced this idea of organizational health literacy. So the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So this is the idea of making sure that organizations are creating fact sheets that actually very clearly convey health information, that healthcare providers are taught to convey information in a way that people can actually use it. Are they using a teach back method? When they ask for questions, are they doing it in a way that invites questions and that they're not just saying the same thing again, but making sure that the information is usable when they're offering it to the people that they work with. This move more towards organizational health literacy is in reaction to the fact that it's easier to measure, it's easier to standardize, and it also removes the pressure of a certain amount of individual responsibility. There are certain things that we can't control, and that having that support from health organizations really makes it sort of a team effort in terms of how we find, understand, use, process health information. So it was mentioned that general literacy is also an important part of health literacy. So literacy in general, understanding, evaluating, using, and engaging with written text to participate in the society, to achieve one's goals, and to develop one's knowledge and potential. I also wanted to introduce the idea of numeracy. So the ability to use, interpret, and communicate mathematical information and ideas. When we think about health information, there's the idea of take one every 6 hours, but don't exceed 4 in 24 hours. So if you do the math, you have to be able to do the math to know that you can't take one every 6 hours for 24 hours. You would exceed the maximum dose for 24 hours. But that is a skill that not everybody has. And especially when you're talking about health information, there's a certain amount of unease that introduces a potential mental block on top of everything else. So when we think about how we can support health literacy, thinking about ways to support general literacy, and then also numeracy and the ability to understand and use mathematical concepts is also a key piece of it as well. So then who does health literacy affect? We think about certain individual traits, when we think about literacy or when we think about written information that's potentially introduced in jargon or only in English. But we also have to, when we're thinking about health information, think about the fact that a lot of the concepts are unfamiliar. So even people who read well and are comfortable using numbers can face health literacy issues. Again, these uncommon medical terms, things that we don't think about every day. We maybe have heard of them once. And, so we sort of scratch the surface of understanding. And then all of a sudden we're faced with this very real, very personal experience, and it's very overwhelming. And so, you have a serious illness and are scared and confused. Again, that's that mental block. Conditions that require complicated self-care. So many steps, so many things to keep track of. And then there's also these wider issues of statistics, evaluating risk versus reward. When you see a commercial for a particular medication and they list every potential side effect because they're legally required to, but they don't have the same weight. They're legally required to list side effects that two people had. So what is the likelihood that you would have X when taking a specific medication? So how do you interpret that when you are faced with the decision to actually take that medication? And then there are also issues that affect a community's health and, voting policy, things like that. Again, it's a risk reward. How do you interpret the risk? When you think about policy around vaccination and the conversations that have been had about that, and things like that. So at any given point, all of us could be faced with a situation where health literacy could be an issue. And so the CDC actually has a couple of talking points where they actually say that 9 out of 10 adults struggle to understand and use personal and public health information when it's filled with unfamiliar or complex terms. Limited health literacy costs the healthcare system money and results in higher than necessary morbidity and mortality. Improving health literacy could prevent nearly 1 million hospital visits and save $25 billion a year. So when we think about what we could potentially gain by improving health literacy, we're thinking about people who potentially put off seeing a healthcare professional because our insurance system, our healthcare system is incredibly complex, and they sort of take a wrong turn in the system and don't get the help they need because they didn't understand the information they were given. Rehospitalizations because people didn't understand discharge information. And so all of these things lead to that statistic about 1 million hospital visits and the amount of money that could be saved. What affects health literacy? And so we've already seen some of these: knowledge of medical terms, understanding how the healthcare system works, ability to communicate with healthcare providers. And that's both a deference to healthcare providers, a willingness to ask questions, but then also a willingness for the healthcare providers to provide answers in a way that folks understand. Ability to find health information, which may require computer skills. A lot of this information is online. Reading, writing, and number skills. We've already seen that in some of the previous slides. And then personal factors, age, income, education, language abilities, and culture. And then physical or mental limitations. And so all of these can combine to have people have bad experiences in the healthcare system. And those bad experiences also can sort of pile up. So if you've had a bad experience, you may not feel comfortable asking a doctor about follow-up questions if you don't understand the information the first time around, things like that. What can you do? What can your organization, what can your library do to sort of help address some of these issues? And so this is, we saw earlier, the Healthy People 2030 definition. This is the definition from the World Health Organization. Health literacy represents the personal knowledge and competencies that accumulate through daily activities, social interactions, and across generations. Personal knowledge and competencies are mediated by the organizational structures and availability of resources that enable people to access, understand, appraise, and use information and services in ways that promote and maintain good health and well-being for themselves and those around them. So I highlighted a couple things there, personal knowledge and competencies that accumulate. These things are things that can be taught as we become more familiar and comfortable with terms, as we become more familiar and comfortable with the systems that work together as that make up our healthcare system. And then availability of resources that enable people to access, understand, appraise, and use information. So again, the skills that can be taught. And so some things that you might think about for your organization, connecting community members to easy to understand health information. We're going to do a live demo of Medline Plus later in this presentation. That's one option. Build individual comfort with health terms and concepts. The library can be a safe space for a lot of people. And so inviting experts into your space to talk about these terms and concepts is a way to potentially mediate some of the discomfort with the healthcare system and introduce those terms and concepts and skills as well that people might need when they are faced with being in that healthcare setting. And then just in general, support literacy, numeracy, and ESL programming to build individual agency. And then the potential to introduce units on health information. So in a literacy class, can there be one class that's about reading related to health information? In a numeracy class, can there be one class that is devoted to something like I was saying before about this idea of if you have a medication, like an over-the-counter medication that says take one every 6 hours, not to exceed 4, can some of those word problems related to health information be worked in? ESL, can there be a class or more devoted to some of the health concepts? Computer classes as well. If you have a computer class, can you do one session that is specifically about finding and evaluating health information online? So then I wanted to switch gears. So that's sort of health literacy. What is it? Who does it affect? Well, basically the answer is everybody at some point. And how can we sort of start thinking about addressing it? One of the things, though, is to also think about locally. What are the specific local needs of our communities? And that using that to help inform the specific kinds of programming. So health literacy data is actually kind of hard to find, even nationally. So we saw the nearly 9 out of 10 adults quote from the CDC. The UNC, Boston University, RAND, Northwestern, University of Michigan worked on a project for a health literacy map, and I'll include that link later, but I did want to mention it. This map does get more local, and it combines census data, which we will look at, with the National Assessment of Adult Literacy to do a predictive health literacy label for census tracts. The issue and the reason why I am not live demoing this is that it uses the National Assessment of Adult Literacy data from 2003. And so that data at this point is outdated. It is a useful and interesting thing to look at, but it may not be the best resource to sort of be the basis for whatever information you're looking for. And then the Office of the Surgeon General had a report that says, and again, using the National Assessment of Adult Literacy, only 12% of Americans have proficient health literacy skills. This is an older report as well. This is from 2006. And so there are some numbers sort of floating around about health literacy. but again, these are potentially older, and they are at the national level. And so I really did want to focus a little bit more local for today. And so how we're going to sort of think about that is going back to some of those personal indicators of what affects health literacy and use those as sort of proxy measures. And that is what the health literacy map folks did. And so we can find that data ourselves using census information. So it's things like age, income, education, language abilities, physical or mental limitations. This says live demo. Before we switch over to the live demo, I did want to mention where the census information comes from, who the Census uh, Bureau is, mostly because, again, it's important for us to know where our information is coming from and who is doing the research. So the Census Bureau's mission is to serve as the nation's leading provider of quality data about its people and economy. I think we're all probably familiar with the decennial census of population and housing. And so that's the every 10 years, the Census Bureau tries to count everybody in the country. It is a larger sample size, so that information is generally more accurate. However, once you get towards the end of that 10-year cycle, the information becomes less current. We are 3 years into the information, so it is still fairly current, but as we get a few more years into the cycle, it will be a little bit more out of date. I also want to mention that the 10-year census is mandated by the Constitution. I think some people there was a lot of conversation about what is the census? Why are they asking us these things? 3 years ago when the census was happening. And so just so people are aware, Article 1, Section 2 of the Constitution does lay out the every 10-year counting of folks. And census information is used to allocate funding, to reallocate house seats, things like that. Recently, within the last 20 to 30 years, the 10-year census has gone to a short form where it only asks the number of people in a residence, the kind of residence, are you renting, are you owning? And then for each of the individuals in a house, race, Latino/Hispanic origin, sex, and age. And then they also ask for relationship to whoever was listed as head of household. So that's sort of the big 10-year. There's also yearly the American Community Survey, and this is where we get some of our more detailed information about languages spoken at home, how long people have lived in a particular residence, their access to the internet, things like that. It's a smaller sample size, so it can be less accurate, but it is the longer form and it is more current because it is done recently. So the kinds of information that we can find from the American Community Survey are some of the things that we were talking about that can act as proxies for for health literacy. So social characteristics, including educational attainment, language spoken at home, disability, economic characteristics include health insurance coverage, income, demographic and housing estimates include age and sex and race. And then housing characteristics also include things like computer and internet use. So again, when we're thinking about people's ability to access information that may only live online. So with all of that, I'm going to move away from and are we still? Okay, so we're still seeing the census website, yeah?
Yes.
Okay. The census 2020, yeah, there were definitely some issues, but given the size, the sample size, it is generally still considered the most accurate survey we have about sort of the broad information. Okay, so this is the Census Bureau website. Sorry for the scrolling up and down. Hopefully nobody gets seasick. I just wanted to mention this before we go into the tools, because there are many tools and actually many surveys and programs that I didn't mention. I mentioned the two biggest surveys. I'm going to show the sort of two biggest tools, but I wanted to mention that census.gov, there are other tools, there are other surveys that actually go around. There's training on some of these other surveys. And then there are also write-ups about various topics. And so some quick links, and then we're going to look at these two things that are highlighted here. So quick data and then the deeper dive data. And so for the quick data, so census.gov/quickfacts, and I'm actually gonna, people want to play along. So when you go to the quick facts page, it gives you the facts nationally for all of the topics. So you can see in general across the country. And since we are a small group, you get to decide where we're gonna go. Whose county or town do you want to see information on?
Does anyone have any preferences?
Got a
Oh, we got Chemung,
Chemung in the chat. So
Chemung County.
Okay, and so there's a drop-down menu. For some of the smaller municipalities, towns, census data does go down to the census tract, but because of concerns about anonymizing information, less densely populated areas may not have that information publicly available. So county is always a good place to start because there will be county level data available. The smaller you get, the possibility that you won't be able to find that information. So we can see quick facts, and then it does a comparison. So if we wanted to do a third comparison, and since I know that Ithaca is in Tompkins County, we'll just add a third comparison there. So yeah, you can see population specific information. So the actual population. There are estimates that are released annually. So this is the 2022 versus the 2020 census numbers. And you can see, they'll estimate the change in population, but then you get down into the demographics. So you can look at, counties that have more children. So Tompkins has about 14% under 18 versus about 21% versus the national average at almost 22%. And then also you can look at sort of the potential for an aging population. And then remember that age, especially folks over 65, that is one of our proxies for health literacy. So if you were thinking about the potential to do a program specifically geared towards senior citizens, I think older adults is the current preferred term. So geared towards older adults, you can find the information saying, okay, in my county, almost 21% of folks, so that would be a sign to say, this is a good indication that maybe this is a group that we should be potentially doing some health literacy information for those folks. So, you can read down the table. in terms of race and Hispanic origin. Can also look at foreign born as a proxy for potential languages spoken other than English, although once we get into the American Community Survey, you can see some more specific information about that. But this just sort of gives you an idea of some of the information that's available. And so you can see it in numbers as well as clear percentages of the population. Again, internet use, computer use, are how likely are folks to be comfortable using the computer? We have some high numbers here, although households with their own internet subscription is down from households with a computer. Education, disability, health insurance, and you'll see that there are these little sort of warning icons. Just be aware those are going to give you information about where the information came from, and they usually go across because it's potential that the information didn't come from the same source, so they're not necessarily comparable across. So although the numbers look the same or relatively the same, the way they were calculated may not make them equal. And then some information on business and geography. So just a quick scroll through this overview. We can also get it to highlight the things we want, so we're not just reading down the whole table. So again, if we're interested in our community for folks over 65, we can get it to specifically highlight that for us. And that becomes more and pull it to the top as well. And that becomes useful, especially if you want to look at the maps. And so pull up the map, thinking very hard. And so we have our highlighted counties that are right next to each other. Well, sort of next to each other. And then we can scroll down for the key at the bottom here. So this lighter color, only 5 to not quite 17% of folks are 65 or older, but then sort of the medium color, we've got the darker the color, the higher the population for whatever topic we're looking at. In this case, we're looking at 65 and older. And then it tells you right at top, make sure you are looking at what you want to look at, and you can change the factor in any of these things. So like, okay, you got a good idea of what the general area looks like in terms of age. Maybe you want to look at veteran status. You can switch right in on that. So again, the darker the color, the higher the percentage. And then you can, as I accidentally demonstrated, you can zoom out as well if you wanted a wider look. And you can also recenter the map if you just want to see around here. You can also look at the information in chart form. So this is giving you, again, a chart, so a bar graph, but it's pulled our comparison counties to the top. But then you can also add counties. So let's see, add Greene County. So in the chart, you can add comparison counties and pull them to the top. And the final thing here for the quick facts is the dashboard, which will show you both the map as well as the table from the home page. So any questions about the quick facts before we dive more into some of the data? So there is also the ability to do sort of a deeper dive into the data. So the quick facts, you can easily pull up the table, the maps, just the basic information. But if we wanted to look deeper, and so the nice thing about the census, the Explore the Census data site, is that it does give you some prompts that helps you fill in that search. And it tells you exactly, you can pull up tables, you can use it to build maps, and then you can, you have this example of Dubuque County, Iowa at the bottom. So if we still want to say, 65 plus, and oh. So across the top, this is all. So it's every table, every survey that the Census Bureau does related to the county. So related to the geographic area that we input, related to the date. So there's our search. Again, we can add modifiers. So if we wanted to do zip code tabulations, metropolitan and micropolitan areas. So I live in Worcester, Massachusetts. And so when we're talking about the metropolitan area of Worcester, we're actually talking about all of Worcester County, and also part of northeastern Connecticut. So when you think about that, metropolitan areas can get kind of weird because they don't necessarily just cover what you might think it does. And then you can see the topics that you can add. So I put in 65 plus. It doesn't look like it found that for me. So I can add population, and I do want older population. And so it added that to our filters, and it tells me that it gives me the result right up top for that particular filter, but then it also will tell me, will give me the tables for the various surveys and related information. So for example, if I wanted to dive into this, I can open the table for demographic and housing estimates. And so it gives me the total population broken down even further than what we were seeing in the quick facts. And so you can, and median age, but then you also are looking, so we wanted it to tell us about older population. So then it breaks the older population down into gender, and you have some racial information. I could have sworn it. I asked it about housing. So you can collapse some of these. You're not just scrolling through everything. Voting age. So again, this information goes beyond what we were seeing in the quick facts, because you can say specifically, for example, scroll back up. age and gender, or if you want to potentially be focused on, where did it go? There it is. 65 is the cutoff generally for older adults for this kind of demographic information. But if you are specifically saying, you want the older adults, you can find information about the fact that in your county, it looks like there are almost 2,000 folks who are 85 years and older. Can also map this information. So particularly this one is sex and age. And then you can also build profiles or have a profile. Okay. So, total population, median household income, percentage with a bachelor's degree or higher. So again, that information is right there for you. If one of your factors you want to look at is educational attainment, which was on our list of potential proxies for health literacy, information about folks without healthcare coverage. And then it also gives you more specific profiles. So if that information is available, you can use that profile tag to dig deeper. So again, population, education, and then some of the information broken out a little bit more. So you can see the town versus the county in terms of the age, ancestry information, things like that. So, language is spoken at home. Another one to potentially consider, although English only seems to be quite high in this town. So there's a lot of information. And again, exploring across the top, we see that there's a health tab specifically. So we can hop into that if it will open. So, if you are, again, we're trying to relate all of this back to potentially figuring out how you might make decisions about where to put resources for programming. So potentially disability might be some information that you would need, especially, and it breaks it down to type. So we see information about hearing difficulty, vision difficulty, cognitive, ambulatory, self-care, independent living. And so, a lot of this is about, again, to try to relate it back to the health literacy specifically, figuring out if your institution is going to do some kind of programming and, figuring out where to focus that information or which parts of your population to target potential programming for. Okay, that is a lot of information, and we have now hit the hour mark, and I have more. So I want to stop for a second and see if there are any questions about that.
I'm not seeing anything in the chat.
Okay. So I'm going to flip back to the presentation. So there's a lot of census data, and it may have become clear that I was sort of a little overwhelmed at the end because there was so much more that I could demonstrate. So I think the thing to be aware of is that both the census data site and the quick facts site, you can poke around. There are different ways to filter, and the most of both sites have tabs across the top that breaks up the information and visualizes it in different ways. So, a few other suggestions for finding health information locally, or finding proxy information locally. School districts are very well aware of the student population and their families, especially in terms of languages needed. And some of that information, depending on how big, again, anonymization of that information is important, but some of that information may be public. If your county or town has a language access plan, could point you in a direction for certain language needs, local governmental priorities, and then needs assessments done by partners. If you have partners in the community who have done needs assessments to say, this population is missing out on XYZ, that information may be something that they could share with you. So then I want to move from the health literacy, the demographic.
We have a comment from Claire. In case anyone here didn't hear about it, there's a data portal for digital equity information that could be used in conjunction with these helpful census data sets. And she shared a link to that source. So that's another good source.
Awesome. Thanks. Okay. So moving on from some of the demographic and proxy information for health literacy, I did want to mention some ways to find information about potential health needs in your community, because that's sort of the other piece of it. One of the things that you think that you might do to help support health literacy in your community is bring in a speaker to sort of help normalize some health terms, help people feel more comfortable with interacting with healthcare professionals. Knowing sort of the health needs of the community can help just figure out, okay, who's coming in, what do you want them to speak on, things like that. So a couple of resources. I'm not going to show any of these. I will share my slides with Christine, so she can share that out with all the links. So the CDC has Surveillance Resource Center, which is just a list of interactive database systems and links out to data sources from across the CDC and then other federal partners. Some of the data sources are archived, so there's no recent data in them, but they are quite well marked with a banner saying, archive, no new data. The Surveillance Resource Center also has some very interesting information about legal, ethical, and policy implications of health data. And then it also has some tools and templates. Looking specifically at environmental health, there's the National Environmental Public Health Tracking. And this, again, is a list of links for other data sources. So again, from across the CDC, and then from other federal partners like the National Oceanic and Atmospheric Administration, the Federal Emergency Management Administration, and the Environmental Protection folks. There is some bilocation visualization, or there is a bilocation visualization feature. And then there was also some funding given to the New York State Health Department to do some environmental public health tracking. And so these are specifically New York State data sets. Again, some of the data is outdated. So if you are digging through some of these data sets to use them as justification for a programming or potentially for writing a grant or something like that, make sure that you are looking at the most recent data. A few other places to look, again, locally. the Affordable Care Act requires that any health organization, hospital, clinic that's getting federal funding needs to participate in a community health needs assessment. And those are supposed to be made public. They are not always easy to find. But if you do try Googling your location and community health needs assessment, you may be able to turn those up. Any local or even state public health authority may have priorities that could be used as justification or help you sort of figure out what some of the health needs in the community are. And then again, looking to your partners, if they have specific priorities, they might also be able to help you find speakers or other folks to come in for any programming. Okay, so I am going to do the world's quickest Medline Plus demonstration. But I do really want to mention this as a resource for you in terms of providing trusted health information to the folks that you work with. So Medline Plus is health information in plain language. It is created, it's one of the resources created and maintained by the National Library of Medicine. And it adheres to science-based, free, no advertisement, plain language standards. And then it also requires all of the links to resources that it links out to also follow those same standards. So when you find information on Medline Plus, the information is there, but then it also can be the start of research out into other trusted partners and what they have to say. World's quickest memory. So Midline Plus is designed again for the general public. So there are multiple ways to search it. There is a search bar across the top, and so just gonna health literacy. It generally does have a drop-down menu. When you search. I'm not sure why that didn't happen this time. And then, so you have sort of the standard search feature. You can filter results by health topics. Health topics are pages on Medline Plus that are aggregates of information. So it's very basic information across the top and then links out to, again, the trusted sources. The medical encyclopedia is the more full information. It's cause, prevention, prognosis, tests, treatment, a full article on whatever the health topic is. If you only want to look for external links, there's a medical test section, a genetics test section, and a drugs and supplements section. If you only want links to the National Institutes of Health information or Medline Plus, there's a healthy recipe and then information in multiple languages. PDFs can be very useful because you can print those off and use those as handouts. And then videos, again, because Medline Plus is designed for the general public, videos can be very useful to help people understand, learn in a different way. So to see the information presented visually, to hear somebody talk it through. So one of the other things to mention about Medline Plus is that it's very clearly labeled where the links go. So National Library of Medicine, those links are generally going to be to Medline Plus. On the health topics page, those links might go to PubMed. And then the NIH links will have the NIH logo, or, the other resources will be clearly identified in the parentheses after the link. So CDC, Health Resources and Services Administration. So this is the Healthy People information. Agency for Healthcare Research is another HHS, and so forth and so on. So I mentioned that health topics pages are really designed to be a first stop in research. So they have this general overview, and then because Medline Plus is designed to be health information in plain language, there are links. So sometimes it's hard to change the jargon in health and health information. And so one of the ways to get around that is to provide links for people to read more about what that particular thing might be. So when you say health disparities, well, what does that mean? Okay, you can link to the health disparities page and check that out. And then, so once you have the general overview, you have the links to other resources. So all of the pages are more or less laid out the same. Start here, related issues, specifics. If this were a disease, there would be a prevention, diagnostic, but again, all links out to other resources, not more information on Medline Plus. Journal articles, again, these all go to PubMed. And then along the side, some help, useful related topics. So the medical encyclopedia entry for this topic, and then other health topics pages. Medline Plus is also available completely in Spanish. It's designed to be bilingual. So there is underneath the search bar on the right-hand side of the tabs across the top is the way to toggle between English and Spanish. And then there are some other health topics and languages available, but those translations are coming from trusted partners. And so not all topics have all languages represented. So if we go back to the main page, there is a health information in multiple languages. So if you are working with a specific language family, for example, here in Worcester, Albanian actually is a useful one to have access to. So I can find all of the health topics that have information in Albanian from that link at the bottom of the home screen. Okay. Medline Plus. I went way over my time for the information. So there was an activity, and I will set it up. And I think that it's something that if you have time and are interested in the in using these resources that I mentioned, I think this is a good way to sort of frame it. And so the scenario that I pulled out is if you're writing a grant, the first section is often an evidence of need or a background section, and then it asks you to say why. Like, why are you targeting that particular audience or population? Why that particular health topic? Why the particular intervention that you mentioned? And so this paragraph here is the wording for our health information, or for our grants in general, for our evidence of need section. So and I highlighted specifically to describe the audience or population that will be reached through this project, and then support the stated need using data such as known needs assessments or statistics. And so if you're thinking about not just for us, but writing a grant in general to support some health literacy programming, the first thing you're going to want to do is, find that census information about the population you want to serve, that information about those demographics in your own community, and then also why you decided to pick that particular health topic, and why you decided to pick that particular health topic for that particular group. So some things to consider, what resources would you use to find data about a need for health literacy programming in your community? And then specifically to use the opportunity to play around with the resources that we talked about today. And then what resources would you use to demonstrate a need for health information on a specific topic in your community? And then again, giving yourself some time to actually play around with those resources to do some searches about related to potential needs, community health needs assessments and or partner needs assessments and things like that. And then the bonus is, what resources could you use in your programming? And I'm going to answer that question right now. Medline Plus, we would love to see folks using that. Medline Plus can also be, incorporated in some passive programming. So, if you have a way to link it to, folks using computers in your library, or link it on your library website, it's a passive way to introduce a trusted source of health information. Any questions about all of that?
I'm not seeing any questions in chat.
Okay. I just posted a link in chat to a class that's coming up next week that I am actually teaching as well. So this is effective health communication and health literacy, and understanding the connection. So it really goes back to the Healthy People 2030 difference between personal health literacy and organizational health literacy. So in that class, we're going to be talking more about health communication and sort of that health, organizational health literacy. So if you are interested, I would invite you to join me for that. There are a couple of ways to stay up to date with us. I will put my personal email in the chat as well. You can also always email our office. We are on Facebook. We are on LinkedIn. We have a newsletter. And the newsletter really is the best way to stay up to date with us, especially if you are thinking about funding. It's the best way to get updates when funding becomes available. And the link to sign up for that is in the chat. And then once again, this is me. And if there are any questions, I am happy to either answer them now or answer them, via email as they come up. We do technically have 10 more minutes. So if folks do want to poke around the resources and ask questions, although I did throw a lot of information at you. So if you are happy to just to sort of sit with it, think about it for a little while, feel free for that as well.
Sounds good. Thanks, Sarah. I am posting the link to the evaluation form. If you want to fill that out, you can do so too. And thanks. This was great. It was a lot of information, but I think it's going to be very helpful. I know for me, I learned quite a bit, so.
I'm glad.
Yeah. And we have thanks and great information from another participant.
Glad folks were able to join, and hopefully you will, as you dig into these things, find use for them. And, again, like I said, if you have questions, feel free to reach out as you start, using the resources. Or I would also recommend the Census has a lot of trainings available on their website for their resources. And so they are probably the best folks to actually get in touch with if you have a specific question about census data or searching census data.
Yeah, I've used the Census site a little bit, and it's just quite amazing the level of information you can get there.
Yeah, It's a lot, but when you really start digging into it, it's really useful in terms of putting things in perspective. Um, I bring it back a lot to sort of the grants or justifying programming. We all have limited resources, and so when people are looking at making programming, things like that, it's a way to say, here are my numbers. This is why this group with this information, because we want to make the best use of our resources.
Yes, definitely.